One question we commonly face in our clinic: Doc, if I am not sexually active, do I need to do cervical cancer screening? I am Dr. Indranil Saha, one of the senior consultants in Bhagirathi Neotia, Rawdon Street Hospital, and today we will be trying to answer this question. Cervical cancer is the second most cause of cancer death in Indian women. And this cancer doesn't happen suddenly. There's a plenty of time where we have seen a pre-cancerous lesion where we can detect whether you are having a cervical cancer. The question is, if you were not sexually active, then you have a minimum chance of getting HPV or human papillomavirus infection in your cervix, which is a main causative agent for cervical cancer. So, if you are not sexually active, do you need to do a cervical cancer screening or a pap smear? The thing is, the chances are less, but we can't say that you can't have cervical cancer. So, we have to individualize the whole care. We have to counsel the patient that even though the chances of cervical cancer is less, still it is wise to have pap smear done every 3 year to 5 year as needed, or if you have any symptoms like abnormal bleeding or bleeding in between your periods. And the test, most people are afraid because they think that the test is very painful. Let me explain you. If this is the cervix or neck of the womb, we just take few cells during the screening procedure. And the most uncomfortable part is because you are not sexually active, the vagina is narrow. So when we put the speculum to see the cervix, it can be slightly uncomfortable. But believe me, we use a lot of lubricant and we have a small size speculum. So just because the test is uncomfortable, don't deny the test. So if you need the cervical smear test or the pap smear or the HPV virus testing, do the test if your doctor suggests that. Don't decline the test only because you feel that it is uncomfortable. We are there to support you, and if you have any queries regarding cervical cancer screening, please mention it or write it to us and we'll try to answer it. Thank you.